about an emerging food policy issue, and that's putting warning labels on sugary drinks. So there's a bill in California that's pending, there's a bill in New York, and San Francisco actually passed a law to put warning labels on sugary drink advertisements. They're being sued, so we don't know the outcome of that yet. But the idea is it looks something like this, where the label would be on a sugary drink and say, drinking beverages with added sugar contributes to obesity, diabetes, and tooth decay. So this is pretty typical in food policy, where there's an interesting idea, but we have zero data on how it influences consumers. So what we wanted to do is collect some data in a timely fashion to inform this debate as it's developing. So I'm going to present one web-based survey of parents where we're interested in testing the influence of sugary drink warning labels on first and foremost knowledge, because that's really the first goal of the label, is to inform consumers. And then also interested in seeing how it might impact purchase intentions. And then we're also interested in testing different versions of a warning label. And finally, we measured support for this policy. So my approach I take to some of these policy issues that I call strategic science, and the idea is, as this is happening, trying to reach out to people who can actually influence the policy. So, maybe directly to a policymaker. In this case, we reached out to an advocacy group co-sponsoring the bill. They've been very instrumental in writing the language for the bill and moving it forward. And the idea with this is trying to co-create questions to ensure that the research I'm doing is maximally impactful and can be relevant to policy. So we chatted with them and we decided it'd be useful to test different versions of a text warning label. And then they also provided a legal team, so we could ensure any labels we're testing are going to be legally viable. We don't come up with a solution that wouldn't pass legal muster. And then there's a nutrition scientific advisory board to ensure any labels we're testing actually reflect the state of nutrition science. So in conclusion, sugary drink health warning labels may reduce parents' perceptions of sugary drink healthfulness. They may increase parents' perceptions of the health risks posed by these drinks, and potentially could decrease likelihood of buying the beverages. And finally, it seems to be a policy in this sample, and there have been other polls done that actually has a fair amount of political support.